My name is Mark Ryberg, and I'm Managing Director and Head of the Physician and APP Workforce Practice at SullivanCotter. And I've been here at SullivanCotter for 10 years, working in all facets of physician compensation, including fair market value work, the evaluation of highly compensated providers, including luminaries, as well as provider compensation design. Potential elimination of non-competes as a result of the FTC policy changes presents a really interesting challenge to many of our healthcare systems. I would say the vast majority are using non-competes today as a mechanism to attempt to retain and protect their investment in their provider workforce. And the elimination of those presents risk because it opens up the door to be able to lose a very valuable resource to a local or regional or national competitor. So organizations are going to have to respond. They are going to have to look for alternative means, probably primarily through compensation vehicles, to try and create more long-term stickiness with respect to those providers. And so I would expect that we're going to see a proliferation, both in the use of existing forms of longer-term incentive vehicles, but also in new and more creative ways to create that long-term stickiness in the form of retention. So some of the legacy vehicles that organizations have used have been balloon-style long-term retention incentives. So for example, if a physician were to start today, we might provide them a retention incentive that's paid in lump sum at the end of 5 years. And what that creates is enough of an incentive for that physician to want to stay at the organization for the entirety of those 5 years. And it also makes it difficult for a competing organization to come in and match that value. Now, you still have to ensure that that value, when amortized over the life of that arrangement, passes certain fair market value standards. But it is one mechanism that organizations can use. And I would expect that as competition increases for talent and as organizations no longer have non-competes to help prevent or defend against encroachment from competitors, we're probably going to see the size or the amount of those long-term incentives increase. I think organizations are going to be looking to more creative benefit plan designs. In particular, I think we're probably going to see the emergence of more deferred compensation vehicles. Historically, deferred compensation was a vehicle that was used almost exclusively for executives to create a long-term economic benefit that created retention towards in favor of the organization. Very rarely have those historically been used in physician compensation arrangements. But I would imagine when non-competes are taken away, organizations are going to start looking to similar strategies that they've used in the executive space and try and see if they can parlay those over into the provider space by creating other deferred compensation vehicles for these providers. I think one thing that is not compensatory in nature but is really closely related is the entire idea of engagement and culture and performance management. One of the challenges with historical provider compensation models is that they were largely production driven. And production driven compensation models were great at doing one thing. They drove production. They also made the management of providers really easy because we could set a target for production and a physician either hit or didn't hit their target, and the result was their pay. And so it kind of became a self-managing or a self-regulating model. The challenge for many organizations is what that did is it meant that they weren't investing as much time in developing and coaching and mentoring physician leaders and how to effectively manage physicians and provider performance. And I think organizations, as they think about what are key strategies they're going to need to retain, both recruit and retain physicians, they're going to find that management of performance is a key element. And they're going to need to invest in more rigorous performance management processes, more rigorous models, and they're going to have to invest in training of their physician leadership talent in order to be able to provide physicians the clarity that they need to understand in this new model what does success look like. And that will go a long way towards building a bridge and enhancing the engagement of those providers and enhancing overall retention.